Well, during the coronavirus pandemic, you might be experiencing stress, perhaps a bad mood. If so, you are definitely not alone. Take it from me. Suddenly people are stuck at home. Maybe you're at work and you need help getting through this incredibly stressful time. Joining us tonight is Dr. Traci Cipriano. She's a licensed psychologist. Traci, we thank you very much for joining us here.
My pleasure, Mark.
Yeah, let me ask you, I think by the time we're done here, you could almost bill me personally for this because I would include myself in this. Everyone is stressed right now. You find your mood shift on a dime. What are signs that people should be watching out for that something is going on here?
Irritability, a lack of energy, feelings of sadness, maybe crying for no apparent reason, frustration with things that never used to bother you before. And then you could extreme sadness. If you find you can't get out of bed, then that's a big problem where you should reach out for help.
I would think you would probably tell people it's important for them to know right now they're definitely not alone, right? I mean, I think a lot of people who never experienced anything like this may for the first time in their lives, no matter how old they are.
Absolutely. You know, this is remarkable. We keep hearing how it's unprecedented, and it's unprecedented in the many ways it's creating stress for us. When you think about the factors that lead to anxiety, it's fear, uncertainty, feelings of lack of control. And we have all of those things with COVID-19. And we have those regarded to our health. You know, we may be worried about loved ones or ourselves. We're worried about, well, when will this happen? How serious will it be? And then there's the financial piece. You know, people are losing their jobs. The economy is in a terrible situation. Either one of these on their own would be considered a major life stressor. Now we have two. And those are compounded by the fact that we get comfort out of our daily routines. And now our daily routines have been upended. You're home when you didn't expect to be, and your kids may be home. We're also being told to social distance. And as a psychologist, when people are going through stress, I recommend social support, getting together with friends and family. So now that coping strategy is taking away, and it creates more stress being by yourself.
Well, it's interesting you mentioned that because I think a lot of people are getting together online and, you know, Zoom apps and things like that, FaceTiming friends and family. I imagine that helps. I know it does me. Do you have any other tips before we let you go? Some positive news for folks who are at home, maybe to turn this around a little bit?
Positive news, I don't know, but I think make sure you get enough sleep. That is the starting point, because if you don't get your 8 hours of sleep, you're not going to have the ability to think clearly and to be proactive in terms of taking care of yourself and your family.
All right. Well, we appreciate that. That's a good place to start. And I think you kind of hit the nail on the head there. We're all in this together, I think, at this point. That's for sure. So no one should feel alone, even though you may.
Yes, absolutely.
All right.
Absolutely.
Traci Cipriano, thank you very much. We appreciate you taking the time to talk with us today.
No problem.
Well, it's